outside the train station here in Los Angeles. In the last video, I tried to explain to you a little bit about what is a virus. Okay, let's see if I can find my little drawing. Here's my drawing. Let's review this. So a virus is a particle, and we talked about how the particle has a basic structure: DNA, a protein layer, and a lipid layer. We talked about how this year's coronavirus has a lipid layer on the outside, and that if you use hand sanitizer with more than 60% alcohol, you got to read the label, okay, that it will inactivate this virus. But there's a lot more to the virus than just what I just said. There's more. You got to keep listening, okay? In this video, what I want to teach you is what makes a virus a bad thing. Well, for the purposes of this discussion, we know that this viral particle, let's just say it's this big, if it gets into your body and it gets into your cells and it starts to grow and replicate or duplicate itself into more viral particles inside your body, then these particles, let's just say that they're in your arm, okay? Now you got all these viral particles in your arm, and you got this big swelling in your arm. Or maybe that swelling is in your nose. Or maybe that swelling is in your lungs. For this year, the coronavirus, that's the big problem, is that these viral particles are getting inside the bodies of susceptible people. And the viral particles are growing, multiplying inside of the host cell. And I'm gonna have to explain all that in a different video. I hope you get this. It's coming. And then as they grow and replicate into more and more and more viruses inside of your lung, it starts to fill up your lung with millions of virus particles. Well, there's more to it than that. Imagine millions of viral particles in a part of your lung, okay? Your body has an immune system. Your immune system has white blood cells of many different kinds. Now imagine millions of white blood cells coming to identify this virus and trying to kill the millions of virus. Now you've got millions of viral particles inside your lung, and you've got millions of white blood cells also inside your lung, creating a mess. It is this mess and all of the problems that go along with this mess of having way too many virus particles, way too many white blood cells in one spot, and then these viral particles may also cause other problems. Again, I'm not going to get into that because you've got to take a class, and actually you might even need a different professor to teach that class, because I'm an anatomist, I'm not a virologist, okay? But I'm just going to touch the surface on this. These viral particles in the wrong place at the wrong time in a large volume, that's what makes a viral infection bad. Something was just brought to my attention that I should explain a little bit more about this too many viruses in one spot, too many white blood cells in one spot. There's a general term for having too many viruses in the same spot, too many white blood cells in the same spot. And I have a feeling some of you probably already know that term, but it's called inflammation. Have you heard that before? Maybe you have. So inflammation it can happen anywhere in the body for more than one reason, not just viruses. Bacteria can cause inflammation. Too many bacteria in your tonsils will cause your tonsils to get large because of the bacterial growth and multiplication. And the white blood cells that come to your tonsils, so your tonsils get swollen up, you come to see me, I do a rapid strep, I give you antibiotics, you get better, right? So inflammation is swelling in a part of your body that normally doesn't have swelling. Okay, so I just added something onto this video for you. That's inflammation. Inflammation occurring inside your lungs will, okay, imagine that these viral particles, the white blood cells, the mucus, and everything that happens when white blood cells die, then they create pus and mucus and everything. Imagine that filling up the air pockets inside your lungs. When they fill up the air pockets inside your lungs, you got less ability to breathe. You know, you can't take a deep breath like you did, especially if one of your whole lungs is filled up, or even half. You know, and that's what's happening to the coronavirus patients who have very, very severe infections. Is the infection has gotten down into the lungs, and it's causing them to have very, very severe problems with breathing. It doesn't happen to everybody. I'm gonna have to wait for the next video for that one. Okay, hold on. Okay, I've had another question. The question is, going on this idea of inflammation in the lungs, why do some patients have to go to the ICU? If your lungs fill up with fluid, you can't take a deep breath. If you can't take a deep breath, you're not going to be able to get oxygen into your body. If you can't get oxygen into your body, you die, plain and simple.